Okay, I'm editing this video a little bit because I started saying that I was going to be doing elbow inspection, palpation, and ranges of motion. However, I meant to say that I'm starting this video doing wrist and hand inspection, palpation, active, passive, and feel, and resistive ranges of motion.
What I'm looking for is just symmetry in between in both of his wrists. Maybe some pathologies, redness, inflammation, edema, some perhaps muscle atrophy, muscle waste, hypertrophy. Go ahead and turn your wrist. Thank you. And things of that sort. Perhaps inflammation and that stuff. Is there any hand that's bothering you?
No, sir.
No?
No, sir.
Okay. So I'm going to start with superficial palpation. First, temperature check. Same on the other side. Okay, normal. And then I'm going to start with superficial palpation. I'm palpating the muscles in between his fingers, the muscles in his hands, the intrinsic muscles, ligaments, tendons, the joints, the bony structures, the MCPs, PIPs, the distal ulnar and radial bones, the snuff box. I'm looking for tenderness. Was that tender at all?
No.
No? And then I repeat that thing in the opposite hand. So I already performed temperature. Now I'm doing just superficial and deep palpation. Is that tender at all? Perfect. So then I'm going to be moving on to active, passive, and resistive range of motion. For the sake of time, I'm going to be doing this only in one hand. However, it's important to do it in both hands. Always you want to start with the unaffected side, unaffected hand. That's going to give you your normal, and then move on to the problematic hand or wrist. Alright, so what I'm going to do is go ahead and flex your elbow, flex your elbows 90 degrees. Hand extended, like that, like so. Perfect, yeah, sorry, elbow extended. And then I'm going to zero the inclinometer out. What I want you to do is flex your hand. That means bring your palm down. Perfect. And that gives me, is that all the way you can go? There you go, 70 degrees. The normal values for flexion is between 80 and 90 degrees. Go ahead and extend, so bring your hand up, up. There you go. Is that all you can do? No, without moving your elbow. Perfect, that's all. So I have 40 degrees. That's okay. For hand extension is 70 to 80 degrees. 70 to 80 or 90. And then I'm going to do radial and ulnar deviation. What I want you to do, hand, elbow extended, and then your thumb, put it here. There you go. So I'm going to place the inclinometer here. And what I'm going to ask you to do is bring your hand down like that, okay? And then upwards, sorry. Okay. Now bring it down. Perfect. That's 40 degrees. Now bring it up without moving your elbow. And that's 20 degrees. So for that's ulnar deviation. The normal value is anywhere from 30 to 45 degrees, and for radial deviation, the normal value is around 15 degrees. Did any of that cause you a problem? Did any of that bother you?
No.
No? So now I'm going to do passive range of motion. So flexion, does that bother you? No. That's tissue stretch. So extension, does that bother you? No. Tissue stretch. Ulnar deviation, does that bother you? That's bone to bone and feel. Bone to bone and feel. Does that bother you? No. Again, I would do this bilaterally. Again, in every single video where I'm doing active range of motion, passive and resistive range of motion, I'm doing end feel assessment while doing passive ranges of motion. Okay, so be aware. Alright, none of that bother you?
No, sir. No,
So now I'm moving into resistive range of motion. What I want you to do is go ahead and try to bring your hand up. Alright, go ahead. No, all the way, like resist my motion. There you go. Does that bother you?
No.
Alright, now bring it down. Does that bother you?
No.
No? Okay, now bring it down. Does that bother you? And push it up. Does that bother you? Perfect. So that all of that is normal. I would do it on both sides. For the sake of time, I'm just doing it in his right arm. Okay, so this next one is called Finkelstein's test. What I'm gonna ask you to do is, first of all, does any hand bother you? Any wrist pain at all? Okay, so go ahead and push your thumb forward. All right, and then I'm gonna be moving it for you. So go ahead and flex it like that. All right, and then I'm gonna push it. Does that bother you? No? All right, I'm gonna do the same on the opposite hand. Perfect. Does that bother you? No. Okay. So positive would be pain in the snuff box area, which is right here, and it would be indicative of the Querbian's disease or stenosing tenovitis. Okay, sir, can you sit down for me?
Yes, sir.
Thank you very much. So, that's okay. This next test, it's called the grip strength test. What I want you to do is I want you to squeeze my fingers as hard as you can. Go for it. All right. What I'm looking for grip strength. If there's like an unequal grip strength, that would be a positive test. And then the next portion of the test, I'm gonna have you go ahead and stand up. And with each hand, turn this way. With each hand, with each finger, I want you to pick up this thing. Okay? With each finger. Alright? Alright, now do it with your opposite hand. Perfect. So if inability to pick this item up with a finger, that would be a muscular lesion, perhaps a bony lesion as well, perhaps a nerve root problem or peripheral nerve root problem, as well as inadequate grip strength in each side, would be indicative of any of those that I just mentioned. Okay, so in this video, I'm doing two tests. I'm doing the Phelan's test and then the reverse Phelan's test. Reverse Phelan's test, it's also known as Prager's sign. Okay, so first I'm going to start with Phelan's test. Sir, do you have any pain at either wrist or hand or any numbness or tingling in that area? No? Perfect. So Phelan's test, what I'm going to ask you to do is go ahead and do this. Perfect. Push your hands into each other like that. And then I'm going to ask you to hold this position for 1 minute. For the sake of time, in this video, I'm going to ask him to do it for 1 minute, but just know that I would ask him to do it for 1 minute or until he tells me that he feels some symptoms such as pain or paresthesia, numbness or tingling along the median nerve, and that's indicative of carpal tunnel syndrome. All right, do you have any pain, numbness or tingling in that area? Go ahead and say yes. Yes? All right, so that's positive test and for carpal tunnel, and then I'm going to ask him to stop. So relax. Now I'm going to do reverse Phelan's test, also known as Prager's sign. Go ahead and do this, as if you were praying. That will sound like that. I would ask him to hold this position for 1 minute or until he feels those signs and symptoms. Do you feel pain? Yes. Numbness or tingling?
Yes.
Where at?
Everywhere.
Can you point to it? So around this area?
Yeah.
All right, close to the thumb. All right, so that's a positive test for carpal tunnel syndrome. That's pain or paresthesia, numbness or tingling along the median nerve.
Yes.
All right, so this next test, it's called the Tunnel sign of the hand. Do you have any pain, numbness or tingling in that hand?
No, sir.
I'm going to be tapping your wrist, letting you know if that causes any pain or discomfort.
Yes, sir.
So go ahead and relax. Relax your hand. I'm going to find the pisiform and the hook of Hammett, and then I'm going to tap in between that. Pain?
No, sir.
Numbness, tingling?
No.
I'm going to do the same on the other side. Okay. Pain, numbness, tingling?
No.
So positive test would be pain or numbness or tingling paresthesias along that ulnar nerve, and that's indicative of tunnel of Couillon syndrome. Or, yep, there you go. Okay, so this next test, it's called the Froment's test. Sir, do you have pain in either wrist or tingling? Okay, so I'm going to ask you to hold this paper with this portion of the hand. Try not to flex your thumb. All right? Hold it. All right, now I'm going to give a little tug. All right, good. Hold it. Let me give it a little tug. Okay, good. So inability to hold the paper, or if he would hold the paper and then pretty much flex the thumb like that, that would be a positive Froment's test indicative for ulnar neuropathy. All right, so this next test, it's called the Tinel's sign of the wrist. What I'm going to be doing is I'm going to be tapping on your wrist area. Let me know if you feel any pain, discomfort, numbness, or tingling, okay? Do you have pain right now, numbness, or tingling? No? Okay. So I'm going to hold your hand. Go ahead and relax. So there you go. I'm going to be tapping over the carpal tunnel. Pain, numbness, or tingling? No. All right? And then I'm going to do the same here. Relax. Perfect. Tapping over the carpal tunnel. Pain, numbness, or tingling. So if he had pain, numbness, or tingling, that would be along the median nerve distribution. That would be indicative of carpal tunnel syndrome. Okay, so this next one is called the ligamentous instability test for the fingers. You have 10 fingers, many joints, so you would only do it whenever a patient tells you that he or she feels pain, discomfort, or some abnormal finding in one of the fingers. So for the sake of this test, sir, you said that you have pain there in your third finger? Yeah. Okay, so always start in the non-involved side first. So I'm going to move on to this hand. And I'm just applying, checking the PIP first. When I'm contacting his proximal phalange and the middle phalanx. And I'm applying a varus and valgus stress, testing those collateral ligaments. I'm doing the same thing at the DAP joint. Did that cause you any pain, discomfort? No? Moving on to the PIP joint of the third finger in his right hand. Is that painful?
Yeah, there.
There. What about this?
No.
Not so much?
Not so much, no.
And what about this, the distal PIP?
Yeah, poquito.
As well?
Yeah.
Here or here?
Yeah.
Okay, so this test for him is a provocative test, pain provocative, however, it's not positive. I do not feel excessive laxity in those joints, so this is just a pain provocative test, but not positive. A positive test would be excessive, laxity movement at either joint, and it's indicative of a tear in one of those collateral ligaments, so a sprain in one of those collateral ligaments.